Okay, so now for a little bit of a walk, and I decided why not just have a little chat about lumbar spine rehab, alright, and how the approach that we take to it. We don't take a traditional physiotherapy approach. We base it on how much force you're able to produce, how strong you are in one position. And that isn't like, that's not like, oh, how many reps can I do, or I can do 10 reps with 10 kg. That's not it. We're looking for how much force can your quad produce, how much force can your glute produce, how much force can your hamstring produce, how much endurance you have through your core muscles. And the biggest factors for us when we're doing rehab is I'll take people through a very, very basic assessment. Your lumbar spine, flex forward, backwards, side to side. Where's the pinch point? Then we look at squat, we look at lunge. And when we're looking at a squat, we're looking for asymmetries. So as you squat down, some people are able to drive those knees forward, load the knee, drop down into a squat, get to parallel or deeper if they're very, very good at. But it's also how you come up out of it. A lot of the times when you're coming out of a squat, a lot of people will just pull up with their back and they won't drive their feet into the ground. So that's a consideration. It's like, okay, my back is sore, but if you're pulling everything with your back rather than driving your feet into the ground, that's going to be a starting point. Then I put them on the table. Let's have a look at a little hip range of motion, see if you can actually activate your abdominal muscles, and if so, how long can you hold in an ab sit for? So that's sitting your bum, hips at 90, knees at 90, and then you're holding in a 45-degree angle away from the bed. All right. And then normally we have a standard for that, it's like 2 to 3 minutes. But most people coming back pain, they're not going to have that. They're not going to have that 2 to 3 minutes or that endurance. Okay. Then we'll maybe take out the dynamo, and we'll get a couple of strength markers for hip flexion. And we have a hip battery that we look at. So it's hip flexion, hip abduction, hip adduction, so your groins and the outside of your hips, and then quads and hamstrings. We don't bother training like internal and external rotation, because when we're training them, when we're training the posterior chain, you go through internal and external rotation anyway. So let's get you stronger in the sagittal plane first, which is up and down, and then we'll get you stronger going side to side, and then we get you a little bit more stronger when you're rotating. So for rotation sports, but it takes a little bit more of looking at how they produce force and where they're producing it from. And you hear a lot of other strength and conditioning coaches and physios and talk about, all right, they've done this test, like they've done a counter movement jump, so how high they're able to jump. But then they do onto a single leg, and their strategy to produce that force may be more hip dominant, more knee dominant, or more back dominant, on one side more so than the other. So yes, all right, you can produce the force. Okay, the force is equally between right leg and left leg, but how you're doing it actually then becomes a factor. And that's the most important thing to consider. So we've done our assessment, we look at that, we got a couple of numbers, and the numbers are definitely going to show up something. And if they don't show up something, then there'll be a ratio that's off. So the ratio is what we look at, is like hip abduction. Without getting too technical, is basically, can you produce the same amount of force pulling inwards with your leg or pushing outwards with your leg? And that'll give us an idea about how well that hip is able to stabilize when you're on a single leg. So that's like walking, running, jumping, landing on a single leg. And then if you are producing force through your glutes, how much force you're able to produce. And again, are you actually trying to lift your back to get that, or are you actually maybe using a little bit more hamstring to try and get that movement? And that's where the quality of the test starts to come in, and you're starting to paint a picture of what actually is happening at the joints and what's happening at the back. So why am I talking about the hip when it's a back pain? Well, basically, just tell me shoelace. Basically, like, your foot is the first point to hit the ground. So if you look at biomechanics, your foot hits the ground, your foot starts to absorb your body weight as it lands, and then those forces need to be dissipated. So when foot hits the ground, muscles should absorb it if they're strong enough. If the muscles aren't strong enough, then the joint takes the load. Now, everybody's different, so it'll come down to somebody's strategy. If they're weaker in the calf, then the force is dissipated to the knee, and then maybe the knee's not able to control that force, it's dissipated further up the chain, up to the hip and up to the back. Then some people will get knee pain, some people will get hip pain, some people will get back pain. But the resounding factor is that it all comes down to force. If you're not able to produce enough force and you're not able to absorb enough force, the load is going to go somewhere. It's just not going to disappear. Like, it needs to go up your chain. And a simple test for this is what we tell to people. If I jumped up and down with a straight leg and didn't soften my knees, I'd get this shudder because I'm landing quite hard. But if you jump up and down, you try to land quite soft. That's your muscles starting to take more of the load as you're landing. And what is, if you're nice and springy and nice and soft in your feet, that's muscle and tendon taking the load. If you're plodding along the place and you feel like your feet are slapping off the ground, then you're not absorbing that force as well as you should be, and your joints are going to take the load somewhere. So our low back pain rehab all starts with force. And you can have people who come in and kind of go, right, okay, yeah, Grant, no, you need to look at movement first. I was like, yeah, but if you look at movement, you can be really good mover when you're moving slowly. That doesn't mean you're able to control it. That doesn't mean you actually are able to produce force. And then you try to move a little bit faster, or something goes, and then you have to be able to adjust for it. Then, let's say like lifting up a shopping bag, or you kind of lose your balance a little bit. That's when your muscles have to react a little bit faster, and they need to produce more force to maintain your balance. So yeah, in my opinion, it's all force and then movement. You need to have the strength qualities to be able to complete the movement. Then you need to have the strength qualities to be able to complete the movement at speed. And then you have to have the technical competency to be able to complete those movements as fast as you can. And that's basically comes down to it. So my rehab philosophy is be able to produce enough force. How do we do that? It's through exercise selection. They say in your 8 to 10 reps. We would normally expose people to a higher load on the first day, so that they're understanding what the difference is between doing light exercise and doing heavy exercise. Oh, but a lot of people say, oh, that's a little bit dangerous. It's like, yeah, there is a bit of a risk reward with it, so you're choosing the patients with which you're choosing the patients that you're going to do this with, and how confident they are doing it, and how confident they are driving those feet down into the ground to recruit the muscles. But the idea behind it is that when you're injured, your body will compensate, and the muscles will lie dormant, and they won't. Your nervous system will tell your muscles to inhibit, to try and protect the joint, to overcome that inhibition. We've all heard people talk about isometric exercise, how good they are. That's exactly it. You're doing an isometric exercise under load to recruit more muscle fibers, to increase the rate of which those nerves are firing. It's called rate coding. The more weight you put onto them, the more motor units you recruit. The more motor units you recruit, the more that rate coding increases. And all of this feeds back to your brain to kind of go, okay, all right, I can recruit these muscles. I'm recruiting them under heavy load at a shorter range, and then I start to feel a little bit more confident. Those muscles start to loosen up, those joints start to loosen up, and those small little exercises that is higher load, it's not under fatigue, makes a massive amount of difference. So that's my 2 pence. Hope that makes sense. If you have any questions with regards to that, please feel free to reach out and we'll chat to you a bit further. Okay, thanks guys.